Welcome to Barbells, Business and Boobs, where Christy and I discuss everyday life as lifters, business owners, and being a woman in a male dominated industry. Christy and I are so excited for this episode today. Christy, what are we talking about?
We're talking about boobs, the boobs part of the podcast. That's what inspired our podcast a little bit, Business Barbells and Boobs, because we did a live together on Instagram talking about our breast implants. So it's appropriate we're doing a full episode because it was only like a 10-15 minute live Q&A, and there's a lot more to get into.
Yeah, Christy and I both get so many questions, and I wish there was an episode like this when I was doing my research. I know I talked to so many people. I was like DMing people like, hey, do you mind me asking? I think you might have breast implants, and I have a couple questions. So it was a little awkward. And then, so many women have them, but we're athletes. We are not only athletes, we are strong women athletes. We were placing kegs and stones and heavy objects right directly on our chest. So I was worried that would affect my athletic career. Christy, I know you felt the same way.
No, I totally felt the same way. And of course, I asked you a bunch of questions. I asked like everyone a bunch of questions because there's so much, our bodies are everything to us, to be able to lift weights and do what we love to do and compete. So I don't want to jeopardize that anyway by, we're slicing ourselves open, we're giving ourselves an injury basically that we're gonna have to heal. And then also things look a little different on us. The same thing as maybe like a certain shirt's gonna look a little different on women with like big arms. We want to make sure that, our implants look the way we want to, but not all doctors are familiar with, what athletes, especially strong women, do, and then, how to fit our shape. You know what I'm saying? So I remember having so much anxiety going to surgery. So like talking to you and all of our other close friends with breast implants really help. But like, you do kind of like see someone out there, you're like, she might have breast implants. You don't want to like ask, and it's awkward. So that's why we're doing this.
Yeah. And again, I want to preface this is surgery. I feel like a lot of times, especially in the social media world, people don't think getting breast augmentation is a big deal. You are going under the knife, so it is a big deal. So we are going to break this podcast down. First, we're going to talk about the background of it. Christy and I are going to share why we got them, dive into some, confidence, self-esteem, things like that. We're going to go over the procedure. Luckily, you have two different procedures. I was over the muscle, Christy was under, so you're going to hear about that. We're going to talk about some of the disadvantages, and I want to talk about the breast implant illness, which seems to be taking over the internet. So we'll share some of our thoughts on that. And we also want to then close out with concerns specific to athletes. So range of motion, getting back to lifting, all of that we will cover. So let's get right into it. Christy, let's talk about when you first thought about getting breast augmentation.
Yeah. So before I was on Instagram and a lifter, I actually, I actually had double D boobs. Believe it or not, natural double D boobs. Okay. And, I guess I was just blessed, but I didn't feel very blessed. I was super self-conscious about it, especially growing up when you get sexualized because you have big boobs. And I was like a tomboy too. I didn't like the attention that I got with having boobs. So when I lost them, I got more of an athletic body because I lost about 30 pounds when I first started lifting. And I was really skinny. That's when my boobs went away. Totally went away. And I was cool with it. I rocked it. I liked having a flat chest. I liked my build. I didn't care as much. So it was really surprising to me when I started like thinking, I think I want boobs. And it really creeped up on me the last couple of years. Let's say I got my boobs done in 2022. And it wasn't until like beginning of 2021, I started thinking, or maybe the end of 2020. So, that was a long time without, my boobs got smaller, maybe like A, B cup, in 2013. So it was a long time that I was like, okay with my body. So it kind of creeped up on me, but I'm going to be honest right now. I really do think it was social media that made me want bigger boobs again. And it was because I was seeing all these women with big, like fake breasts, and the way they looked in clothes like appealed to me. Like I honestly still don't even really have a lot of clothes, and I haven't experiment with style as much lately, but I used to, and I just wanted more shape, and I started not feeling as self-conscious about it, but I'm like, no, I want that. Everyone's gonna have different definitions of femininity, but I want to feel feminine again. And so that's when I just kind of started thinking about it. But
Mm-hmm.
so that'll just be me being honest. Like it probably was a lot of influence social media, because even to this day, my explore page is a lot of big boobs, because I think I'd be like, oh, I think I like that. I like that. So I guess it came from a little bit of insecurity, but I wanted to feel good. I wasn't like, oh my God, ashamed of my body, but I kind of missed, what I used to have per
Mm-hmm.
se. So how did you start to kind of think about that? Because, I got mine more recently, but
Yeah. So I went through puberty really young. I believe I got my period and actually had to start wearing bras in fourth grade. So I remember, kind of similar to you, I definitely didn't have double D's. I was about a C when I was younger, and I remember trying to hide them because everyone would be like, "Oh, you must stuff your bra," things like that. And then I didn't. I hated them. And then once I started getting more athletic and like training upper body in high school, I remember one day I was almost like confused. Like they just kind of seemed to have gone away overnight. And I remember wanting to go on birth control because my friend said, like, oh, that'll make, your boobs bigger. And I started to become extremely, extremely self-conscious of them. And like sophomore year, I want to say, is when it got really bad, because that's when I kind of started lifting, getting more muscular. And I remember I would buy those expensive, I used like all my babysitting money, went to Victoria's Secrets. And do you remember those like $60 bombshell sports bras?
yeah, oh yeah, I do.
Yeah. So I remember I'd put those on and I would feel so good in them. And then when it was time to go to track practice, I had to take it off. Like I was just really, really embarrassed. And also my mom had breast augmentation, and she always, encouraged me, like, you don't have any kids yet. You have a beautiful body. But I think because I was around that, she actually even worked for a surgeon. I was just around it so much. I wanted them so, so bad. Like, I was the girl, and I'm just being completely honest on this. Like, I remember the first time, when I was a little bit older and started having sex, like, I wouldn't take my bra off because I thought I was so ugly and so ashamed of them. Luckily, I got kind of, I developed more confidence in myself. And after college, started getting into strength training and strong moment even more. So I kind of just pushed the idea. I always wanted them, but I pushed the idea away because I was like, I'm a strength athlete. There's absolutely no way I could ever get breast augmentation. It would ruin everything I do. And then, so let the idea go. And then a couple years later, I was at a pro strongwoman show when one of the girls that was an amazing athlete had them and was talking about it. And I remember I was like, wait, what? You have breast augmentation? And that's when I knew, like, okay, I'm going to do all my research and I am going to pay off my student loans, and then I am buying myself boobs.
Oh my gosh, what year was this again that you got it done?
2017. I actually booked my surgery. I planned like my whole year out. I had my surgery booked 10 months before I got it
Oh my
because
gosh.
I knew I wanted to compete, and I perfectly aligned the time off with it, with like work. So I got it the day before Thanksgiving in 2017. It was a Wednesday morning at 10:30 a.m. I still remember my appointment. Um, the doctor probably thought I was the most annoying patient because I went for my final like pre-surgery appointment. I went 5 times. I kept changing the sizes and I kept bringing
Mhm.
different clothes and I kept asking questions, but I was just so excited. So yeah, that's a little background. I wanted them for 15 years before I got them. So
That's crazy, because I feel like I wanted them for like maybe a year, and then I thought about, but like when you kind of know as well. But you also have to be like in a certain position with your competing, and financially to do it is a lot. I mean, I kind of felt guilty about spending so much money on my appearance. I don't know if you felt that too, but
Oh
I
yeah.
mean, is this really worth it? Can I just live without this? But for me, it just seemed like the right time. Like, it's funny, we planned them around our competing. I did it right after the Arnold of 2020 because I knew after that, I'd feel okay to take some time off. But yeah, so you always have to keep that in consideration as well.
Yeah. So I know I'm surprised that because I do remember reading because I remember you would get some crap on social media, like, why don't you have breast implants, things like that. So I was pretty shocked when you did.
Yeah, yeah. Well, you know what too? Because that's the thing. That's a weird thing too. It's I was at a point where I'm like, it kind of was fun. It's kind of fun to when your body pisses someone off. It's like kind of funny to me. You're like, why do you freaking care? And that really, so the comments never made me feel like I should get them. The comments never did. And it's funny too, and you probably get this all the time as well. Like, because you have big boobs, people are like, oh, you're just like, you're showing off your boobs, or you're like too sexy, or, a bimbo or something, like, instead of a serious athlete. So it's going to always go either way. So it was never the comments, like those still for some reason just don't get to me that much. Like, negativity gets to me because it makes me just like not like the world in general. But those, I don't take it personally because I'm like, shut up. Like, and I was actually fine with my small boobs, but when you get older too, like my boobs were small, but they started to like kind of like deflate a little bit, to be honest. So I was like, I want to pump them up, and that was really the reason, rather than, thinking, oh my God, I need to have big boobs because the internet says so, or anything like that. But I was afraid of setting a bad example. Like, I thought people were going to judge me, like people, because I've always been, not saying I'm totally on board with everything body positivity movement, but just saying embrace yourself, be proud of your body, be proud of what you built. And then here I am putting implants in. Did feel a little bit of that shame. And I was so nervous to tell people. And I felt like I had to tell two people because it's just gonna be like, I want to be transparent. I'm like you, like I want to be transparent about things just because you don't want to feel like, you want to be authentically yourself and you don't feel like you're trying to dupe people. But not that you have to disclose plastic surgery, but yeah, I did feel like scared to tell people. Were you scared to tell anyone? I know you grew up around plastic surgery a little bit, but were you scared?
No, that's a great question. So I want to bring it back to the underlying factor as to why I got them was because I remember finally feeling confident as a woman. I think I was around 26, had a good job, liked how I looked, loved my body for the first time in my life. And I just knew that I couldn't build that. So I knew that if I got them, it would help my self esteem and confidence, which it 100% did. On the downside, that's the thing I was probably most fearful of, is wondering what others would think and how it would affect my brand, because I was very well known in the strongman community and looked at like a role model. And I remember asking people, would they judge me or think differently? And other women that had them just kind of warned me that, some people might be jealous because they want them, but don't have, the balls pretty much to go and undergo surgery. So I was kind of warned. But no, to my surprise, everyone was just really thankful I was open about it, just like you. So that for me, kind of, once I got them, I just kind of didn't care anymore what anyone
Yeah.
thought. So it's certainly, getting breast augmentation, I don't want to say it changed my life or anything, but it certainly helped me finally feel, this might sound a little weird, but it felt like I felt like home in my body. Like, I
Mhm.
felt like this is how I should look. I finally feel feminine.
Exactly. I think it too, because like a lot of times as female strength athlete, we struggle to find, that feeling. And I even still struggle to find that feeling a little bit. But it's definitely helped. So both of us, I'd say, let's thumbs up improvement in our lives for breast implants. But that's just us. Not going to be everyone. And we'll definitely be going over some of maybe some things that could happen, or disadvantages, or the hardships, of recovery and stuff like that. Because like you said, it's a serious surgery, but thumbs up from us.
Yeah,
So
thumbs up
feeling
for
good.
sure.
Yeah. Do you want to move on to our different procedures?
Yes. So when you first start researching breast augmentation, and I do want to make it clear that Christy and I only had breast augmentation implants. There are so
Mm-hmm.
many other things like a lift and even lateral, like even things that
A
that have
mastectomy, stuff like
changed
that.
in the medical field. So all her and I had was the simple surgery of an implant. It gets a little more complicated when other factors are involved, like a lift. So the first two things that you're mainly going to hear are under and over. So let's cover that. Chrissy, let's start with your under. So let's talk
Mm-hmm.
about what that looks like versus
Right.
over and why
Mm-hmm.
you chose that.
Right, for sure. And this is like a question I feel like I stressed about so much, over versus under, especially in the fitness, bodybuilding, strong man powerlifting world. We take our muscles really into account, right? Now, there's always, going to be debate between over versus under, but most, or what under is they are putting the implant underneath your pec muscles, the pec minor, and that just makes it so that it is a little bit more of a smooth transition from your, chest, the implant. So in theory, it's going to look more natural depending on, your body and what it's going to look like on you and your size. It also is safe, quote unquote, safer because it protects it from rupture, although ruptures are extremely rare. And depending on what type of implant you have, may or may not be that dangerous. But a ton of doctors are really going to push you to go the under route. And the advice I got was, Christy, you have muscles. When you flex, if you have them under your muscles, they're going to, flex. The implant's going to look weird because it'll flex with your muscle. So that is a con of that. But also, I had didn't have much breast tissue. So having it under the muscle makes it a little bit smoother so you don't see the implant as much. If you already had a lot of breast tissue, that wouldn't be a problem. So those were the considerations. I almost got over the muscle
I
until
remember
last
them.
minute, but it's because my doctor convinced me that he did a surgery on someone who was in WWE, a woman, um, and said that she's recovered very well, really fast, and they look great. And I was like, okay, well, that kind of convinces me more to go the under route. Like, it's going to work out. But I was very afraid to mess around my muscles at all. So I went that route. It being under the muscle may or may not protect the implant a little bit more. Now, and I'll talk a little bit more about this later, but now that I do have it under, do I think I would be happy with it over too? I definitely do, because I see a lot of girls with over who I really like their look. So, I didn't want them to look too fake, but I'm thinking, now I think back as like when I said, I don't want them to look too fake. I did want them to look fake. I just didn't want them to look like crazy bubble porn star fake, but I did want to look fake. But in my head, natural was still these perfect big fake boobs. So just to let everyone know, um, I probably could be happy, or maybe they'd look crazy on me because of the way my body is. I don't know. But do they look good? Yes. I'm happy with them. Yes. And everything worked out. My recovery is very smooth. So that is why I chose under the muscle. But honestly, I think either one would have worked out for me. And
I'm over.
everyone, yeah, and every bodybuilder, every strong woman I know, except for like one, told me to do over because of they might look weird or mess with your muscles. So, you know, I think that might be more popular, but I don't know.
Yeah. So I'm over, and I definitely think, Chrissy, that yours look more natural. Like if I didn't know you, I would never even speculate that you had breast implants. For me, you can definitely tell, especially when I'm lean, they do look fake. Like when I'm on stage at 5% body fat, you could see the implant outline. When I'm normal body percentage, like now, I actually think they look pretty natural. But the advice I received from my mom, again, who worked in the field, she told me to go get consults with minimum 5 doctors, because she said doctors, especially for, I hate to use the word routine, but breast implant breast augmentation is one of the most common surgeries these days. So she said that surgeons often perform, they're kind of like a hairdresser where they like one style. So I went to a couple and they were like, nope, I only do under. I don't like how over looks fake. But in my head, again, I was open, but I kind of had this preconceived notion that I wanted to do over because at the time in my life, I was really into obviously strongman, but I also was really into like heavy dips and heavy pull-ups. And I saw some of these CrossFit athletes. I didn't like the way that the implant, when you were doing dips, pretty much went out to the side and you could see it. Again, not a huge deal. It was only when you were doing something, but I remember my friend who had under said push-ups never felt the same again. That was just her experience. I don't know. You do plenty of push-ups, you do weight of everything.
They're definitely a lot harder, and I definitely feel them move. Like I'm definitely see where you're going with that for sure.
Yeah.
I definitely think that is a con.
So I did end up finding a doctor who had operated on 3 people I knew. They were all under. I went to him, and when he looked at me, I loved his work because it looked really natural. Again, like you, I didn't want to have that in your face, fake porn star look. So he said that I would be a good candidate for over. And he said he usually doesn't say that, but I had a lot of lateral breast tissue from when I was a C. So I didn't really have much cleavage or anything like that. And he did make it known. And I want for anyone listening to know that they are still your breasts. They look, unless you do something like a lift, or now they have other procedures where you can put like a wire to push them up. Unless you do something like that, it's still going to be your breasts, just bigger. So I ended up going over, and I am extremely happy with them. I did take the advice. Everyone told me go bigger than you think. So I'm hesitant to say this on a podcast because but I want to preface it with everyone's chest wall is different. I'm a big girl. I have huge shoulders and a huge chest wall. So I got around 600 cc's, but I'm only a D now. A 600 cc's on someone else might have them toppling over. If I only got 400 cc's, like I know I would not be happy with my surgery. I'd be maybe a B or a C. So I'm extremely happy with that. And then I also want to touch base on there's certain profiles you can get. There's like a super high, a moderate. I chose moderate because again, I didn't want that really fake look. And I can still, if I wear, I don't, one of the benefits of having surgery is you don't really have to wear a bra. Your boobs just kind of there. But if I do wear a real bra, I can push them up and get that look, but I don't often like to do that. So do you know what moderate or what profile you have?
Yeah, I got moderate, the gummy bear moderate profile ones. And the interesting thing about wearing a bra is for a while, I was not used to wearing a bra before I had surgery. And then after I recovered, I stopped wearing a bra as much, because I sleep without a bra and stuff like that. But my breast started aching. And then I started wearing a bra again, the aching went away. So for me, now I feel like to wear a bra more. So there's a con as well. And
They ache still?
if I go braless for like, multiple days in a row, yeah.
Oh, wow.
Yeah.
That's interesting.
So I'm not sure if that's just the card I was dealt um or me going under. And I definitely do agree that you should go a little bit bigger than you think as well, like what you said. And everyone all told me that, and now I'm like, I should have gone even bigger. But that's
And
just how it
another
goes.
aspect too, Christy and I both have the gummy bear, which is the silicone.
Mm-hmm.
Saline is also another option. It's not as popular anymore, but it's still out there. I just ended up choosing silicone Sientra because I like the warranty. I saw
Mm-hmm.
videos of like an implant being dropped from very high up,
Yeah.
being run over, and nothing impacted that. So that's why I chose that. It's very
Mm-hmm.
common. Honestly, I don't even I don't even know anyone that has saline that's gotten breast augmentation within the last
Mhm.
5 years. I don't think it's very common anymore.
Right. Yeah. And for the recovery, I know we'll talk about the recovery in terms of us returning to training, but for immediately after the surgery, let's talk about how it felt, because we had different surgeries. So usually apparently the under is going to be, it's a little bit more invasive and have more recovery. And I actually have a friend who had a couple friends who had the worst under the muscle recoveries, just like so much pain for a whole month, super tight. But me, I was like, my doctor really encouraged me to like lift my arms over my head a lot. I was you know, walking a lot, and just like I was honestly just felt fine. I just couldn't lift. So I actually had a very easy recovery. Like after the next day, I was like working on my computer. Like I was totally fine. Like I felt like nothing happened. But obviously going back training a little bit different. We'll go through that later. But how was yours? Were you super painful? Were you out of work?
Yeah, so this was my first, besides wisdom teeth, like my first real surgery. Of course, after I had a lot of bad luck and had a lot of actual, like real surgeries. But, breast augmentation, whether you're under or over, the good thing is there's no prior trauma there. So it's a pretty clean surgery. So for me, I remember I woke up, I'm obviously still on drugs. And I remember like I wasn't in any pain and I just wanted to see them. But, you're all bandaged up and you can't. But I was so hungry because you have to, fast that morning. I went out to eat right away. And then I got home and I looked at them and I was like, oh my God, I made a mistake. These are humongous. But obviously that was
Swelling.
there's so
Yeah.
much swelling. And then I don't remember being in pain that night. The next morning I went to Thanksgiving and I was like in a little bit of pain, there's like I was afraid to like use my arms and I needed help showering and stuff like that. But I think I was honestly just so excited that it just masked out the pain. I do remember a couple days later, like in bed, because you have to make sure you obviously, the hardest part for me, I'm a side sleeper, was like getting a pillow fort and making sure I was propped up. I believe on night 3, I did take some of the painkillers because I made the mistake of like forgetting I had them for a second, like getting up. And like you don't realize how much you use your chest for everything, like getting out of bed until you can't. So that hurt really bad. And I took the painkiller. But then that Monday, I was back at work and I didn't tell anyone at work I was getting it just because, I felt like that was a private thing. And I also wore scrubs. I was in medical, so I could hide them. But I
Right.
do remember I had to do an in service at a hospital, and the person I was working with asked me to hold and
Oh,
carry
yeah.
around a briefcase with a device in it, and it was like 20 pounds, and I should not have been doing that, and I did
Mm.
that. And then I remember I was really, really sore after. And about a week later, I remember I was riding, and my boyfriend at the time, he had a truck. And driving is what kind of hurt me the most. Like bumps in the road in his big truck, like really hurt. I remember it almost felt like a burning sensation. But again, I kind of went a little rough on them. And then 2 weeks later, I was actually in a car accident and I was afraid that I had completely ruined my surgery. But I went to the doctor right away and he told me like they look beautiful, nothing happened. So that kind of gave me the confidence, like to maybe push it a little sooner than I should have, because I was like, I was in a car accident and nothing happened. Like I'm clearly fine. So I remember I was actually doing log and front squatting a month later. The only thing that took a full 12 weeks, he told me it would take a full 12 weeks to get back to normal, was pull ups and lat pull downs. And my first stone did hurt, but I think I did it too soon. But
Yeah.
yeah, so that's kind of how it was.
Yeah. So not so bad for us, but I've definitely heard a lot of stories of people just like being miserable. And it really just depends how tight your chest is, how big you go, and your own anatomy and all that fun stuff. So anyway, do you want to go over to the disadvantages of breast implants?
Yes. So some of the disadvantages, Christy, you already mentioned your breasts aching, which I thought was really interesting.
Yeah, I kind of forgot about that, but yeah, that is a disadvantage for sure. I wanted to just not ever wear a bra again. And you never know until you get them really what you're getting into. Also, any like we said before, it is a surgery, so there could be complications as well.
For me, the
Anything can
biggest
happen.
disadvantage, like I said, I'm a big girl. I have large traps, large shoulders, large everything. And now that I also have large breasts, I notice that I do have more pain in my traps and things like that
Mm,
because everything is so tight on me. It was before, anyways, but now it's just, I have such a, my back is so
right.
wide that when I am wearing a real bra or sports bras, I'm extremely like, I almost get like so much tension in my traps. And I do think that a lot of that is because of, now I'm just a big girl. So that's definitely a disadvantage. I don't really think about it anymore. That's why I don't wear a bra a lot of the times, which is a benefit. So that for me has probably been the biggest disadvantage. And the only exercise that really affects me is, and I still do it, but heavy seal rows. So when you're lying flat down on
Mm,
a bench and pulling a barbell into you, that feels weird. It doesn't affect my performance. I'm still able, not at the moment, but I could do like 200 pounds for reps with breast implants. But it just felt like I could feel the implant, and I think that
yeah.
distracted
Hmm.
me from the actual exercise. So
Yeah, for
chest
sure. There are
warmth.
different exercises. Yeah, there are exercises that do feel weird, and that's a really good point, like as a disadvantage. Um, Something that a lot of people also talk about too is breast implant illness,
Yes.
which I is the most common like DM I get about it because I think a lot of people are very afraid of it. Now, I feel like it is controversial because you do have people saying, "Oh my God, like I've gotten it. It was awful. My symptoms went away when I got my breast implants removed." And then you have people like my doctor over here saying, "I don't really think it's an issue." And most people who get their breast implants removed because they think they have breast implant illness, like it wasn't that or something. I hear both sides. I'm not going to say I'm an expert on breast implant illness. I do say it should be something that people should take into their own account. Um, I don't think I have it. I've never known anyone has it, but apparently everyone in my DMs do know someone who's had it. So take it into account.
Yes. I want to talk a little more about that because we can't do, it's 2023. We can't do this episode without talking about breast implant illness. And I want to first say that I remember when I first got surgery and was open about it, I got like attacked from the breast implant illness crew via social media saying, there were some people that were extremely informative and just trying to help. Like, I just want you to know this experience happened to me. But then there were some people that were like, you and like anything on the internet, they were like, you're gonna die, you and your fake boobs, blah blah blah. So I started, and I was recovering from surgery, so I remember reading those and getting extremely anxious. Like, is this a real
Yeah.
thing? What happened? So again, like Christy said, we're not experts, but I view breast implants like any medical device. Okay, so there's always a risk. I have a fake wrist too. I have a bunch of metal. There's a risk my body could have rejected that. Some people have life threatening diseases and need some sort of pacemaker implant. There's always a risk with anything involved. For me, my mom, who is more on the holistic health side, had them and never had an issue. And I've never had an issue. I think, like anything, you can start listing these ailments that you're experiencing and match up to like any autoimmune disease or breast implant illness. So I think it's like anything, it's almost like when you Google, you have a hangnail and you Google something, it's like, oh no, I'm dying. So that's my opinion. And I don't want this podcast to start anything. I don't want Christy and I to be attacked. We just want to share our experience. And so far, I've had my implants for 7 years now. No issues whatsoever. No help. I'm very healthy. And Christy's had
Hmm.
them for a couple of
Yeah.
years and no issues. So that's where we want to
Hmm.
touch on that.
Right. Just how both of us had good experiences with our surgery, no complications, good healing afterwards. some people do not have that experience. The same thing with breast implant illness. We didn't have that experience, so we can't really talk on that. And I feel for anyone who has it, but also like, don't attack people about it, because for some reason that is like a hot topic to attack on. But for sure, obviously, if there's a valid concern there and you care and you can say it in an informative way, that's great if you want to inform us on that kind of stuff. Other disadvantages, you might not be totally happy with your results. Honestly, you said this before, they're still your boobs. And we had a conversation one time at an event, and someone saying that they wanted breast implants because they felt like their boobs were too far apart. And that is your anatomy. When you put your breast implants in, they're just going to make them bigger. There's, like you said before, there's other things you can do, but they're still your boobs. They're going to look like your boobs. They're not going to look like, you could say, I want them to look like this. They're still going to look like yours. So you have to be able to be happy with it. And I think that's when you get into a lot of people, a cycle of people just continuously getting them redone and redone again. I'll be honest, like, I do think I want to get mine redone just because I do want them bigger, and like to look a little bit different. And of course that bums me out because it's been a big investment. And, then you have to kind of ask yourself, when is enough enough? When am I okay with this? But, and then, or if I get the surgery again, would I've been like, man, my other ones are better. Like, I just fucked these up, that's kind of like where it gets complicated. So there's the disadvantages is not going to fix all your problems. Not like I was expecting you to. Not that I'm unhappy with mine now. Okay. But, you still have to be happy. That's where it proves that you still have to be happy with yourself before you get the surgery, because it's not going to fix anything. And then you could just keep getting surgery and never fix that problem. Not saying that's why I want to get different ones, but, I'm just bummed out. They're not like what I had in mind. So that's the reality of it. They're awesome, but also maybe you could not like them or want to, have complications and stuff like that. So those are the disadvantages, at least just for everyone, not even talking about just about athletes.
Yeah, that's the most common thing I've heard, is that people wish they had gone bigger. Me personally, I am very, very happy. And where I've had them for several years now, I actually don't even, like, unless I'm talking about it with someone, I actually like forget that they just feel like a part of me now. I forget that
Mm-hmm.
they're fake and that they're there. I did want to say too, one of the disadvantages, so it was my left nipple. I thought, I was scared that I lost sensation for a long time, but then I think it was about a year and a half, maybe even two, that I couldn't feel anything. And then all of a sudden it came back. So that was, obviously kind of a disadvantage. But again, right now, currently they feel like normal. I just think that you may be back to normal training, feel and look normal, but there still might be a
Mm-hmm.
little like sensation loss. I've heard a lot of people mention that. So I just want to be clear about that.
Yeah, it's so scary too. But and then like when you start, like, this didn't happen to me, but they told me when my sensation if I lost sensation when it comes back, it could be like pins and needles. They said like a sensation. I didn't get it, but they were warning me like, oh, you could have just like pins and needle feeling. So, if you have that, don't be too alarmed. Um,
Um,
Go
One
ahead.
more disadvantage too is that these aren't necessarily permanent, in my opinion. I do think, and again, this is just my opinion, but it's a medical device. Um, we have a lifetime warranty on the silicone Sientra, but just from doing my own research, I do feel, depending on how your lifestyle, maybe if you have kids or gain weight, I know that I want to change mine out in 20
Mm-hmm.
years, because just from what I've seen, like, that's when I feel that the implant is old and I would want to replace them. So that, that can be a disadvantage if you have to go under the knife on, voluntarily again. I know that when I do it again, I will go smaller and probably go under, just because I will be almost 50, by then. And I hopefully will lose some upper body size and want more of that natural look then. So just thinking down the line, again, you have to, that's, I guess, having surgery, it's not it's not always going to be a one and done deal. So that can be a disadvantage as well. But overall, I'm on the pro side. Like I said, it's benefited my life in terms of confidence, self-esteem, all that. So
For sure. I was so nervous before the surgery and it all turned out good. Like, for sure, a pro. Like, I feel like a big improvement in my self esteem, how I feel in clothes, out of clothes, all that stuff. I'm just saying I want them bigger. So
yeah.
I would do it again because last surgery was so easy for me. But speaking of easy surgeries, let's talk about after the surgery because I think we both actually had pretty easy recoveries, an easy way to get in training. But we know how to train and how to recover. We're coaches. We know how to progress ourselves in a way and kind of be smart about it. My doctor, the first 2 weeks you couldn't. For me, for my recovery, I couldn't get my heart rate above 100 or something. That is to prevent blood clots and stuff like that. But they do want you walking and active. And then he allowed me to do lower body training on machines and body weight, but not stuff that you can pick up a plate and put on, right? A machine that you would adjust with the resistance because you still cannot be lifting. I think it was like over 8 pounds or something ridiculous like that. Because I was scared to pick up Tootie, our smallest Chihuahua. And so I did that for 2 weeks, nothing, 2 weeks lower body. And then I did, after a month, I started really light lower body or upper body with like really light dumbbells and machines. And, of course I wanted to get back into like my heavier lifting. So what I just did was kind of a hypertrophy cycle with barbell overhead press. I just started with a barbell for, 15 reps. And then, each week just put a little bit more weight until I started feeling a little bit more normal again. And I was able to kind of slowly progress more into a strength cycle. But my range of motion was always okay in there. Like right after the surgery, I was able to put my arms up above my head and, I was doing like arm circles and stuff. I was encouraged to do that by my doctor. So within like 2 months, 3 months, my training felt more normal.
Mm-hmm. Yeah, like I said, I touched on it earlier. My range of motion wasn't as good as yours immediately. The fact that you could raise your
Mm-hmm.
arms above your head was huge. I remember like washing my hair and stuff. I waited a couple days. That was still like kind of awkward I was like, it was a little painful to stretch the pec whatsoever. So like putting my arms behind my head, I'm stretching my pec. So that
Yeah.
was a little painful. And then certain things, I felt like I was just very, very cautious and careful of like how I took my shirt off and how I did things. But it's funny because you start to test it. Like you don't realize that you're putting a plate away or reaching up
Right.
to put something, in your cupboard. And you start like, oh, I just did that. And like little by little, like I said, I think me getting into a car accident was like, okay, nothing's going to happen. Like I said, pull-ups, my first pull-up, I was very scared. I did it about 8 weeks later. And I was like, okay, I am not going to do a pull-up for 12 weeks. And then even when I did do pull-ups, it took me, and again, this could just be because I took time off of strength training, but I almost felt like I had to learn to reuse my lats, which isn't even related to my pec, but I think like my arms wanted to take over. I was afraid to like engage my lats. So I just did some assistant movement. And then I remember like for the first time in my life, I actually 12 weeks after started isolating my chest because before I didn't want to do pec deck or anything. I would just do compound movements because I was like, I don't want any more muscle in my chest. I don't want to risk losing even more from the little that I had left. So I started doing like chest isolation movements. And I remember like getting excited that I could see some muscle definition there. And like I said, it looked pretty natural until I did women's physique. And then I remember I was so lean, like your skin is literally thin that I could see the implant, but also anyone on stage at that level of leanness, whether they're under or we were going to see it. But yeah, as far as recovery, I competed, went back to strongman, did a powerlifting meet 9 months after surgery and did another strongman show within, I think, 14 months. I could have gone back sooner. No big deal there. But yeah, went back to normal. Bench press. People ask too, and I wanna I wanna be very careful. People are like, did it help bench press at all? No, it did not help bench press or log or any of that. It literally felt exactly the same. And oftentimes, a strong woman question we get, Chrissy, have you ever gotten like, did it make log harder? No,
No.
it felt the same. So,
Yeah, it always sucks to put like a heavy thing on your boobs. It's just how it is. It's like it's
yeah,
just heavy weight. And I had my back injury after the Arnold 2022, but then I had my boobs done, a few weeks later. And so I did take some time off, and then I took some time off competing. But after I recovered from breast augmentation surgery, I did start to slowly, gain strength and stuff like that. And I did end up PRing my like split jerk, not, maybe like uh, 6 or 7 months later. I mean, it was pretty
yeah,
crazy. So and I didn't compete again until recently, but it was more so of my back, not because of my boobs. But I have made strength gains all around. But I will say, man, those push-ups, dips, and pull-ups are so much harder now, and they do feel a little different. I think I'm just a little more scared of them, like afraid. I've been doing more like close grip push-ups instead, and I still do work on pull-ups, but dips, I just feel a little bit of pressure and tightness still, but I think you're just gonna have to, I know it's just a body weight exercise, but if you weigh 165 pounds, that's still a lot of weight, right? With
yeah.
on your muscles. So just assisting those exercises or swapping for lat pull downs or lighter dumbbells at first. Because for some reason I was like, oh, well, I'll just ease it back to upper body training push-ups because they're easy. Well, that wasn't, I quickly realized that probably wasn't the best route because I could barely do a push-up, like, a few weeks after surgery. So just actually moving with machines and dumbbells was better first, and then coming back to those push-ups felt so much better. So don't get scared if you're like, I can't even do a push-up. Honestly, like push-ups are hard. We forget about that. Just grab some lighter dumbbells and do some presses. That'll be better at first, and then use assistance for those other exercises, because you will get better at them. And you just can't get lazy with them like me. But I just got like a memory of me doing pull-ups with 45 pounds and stuff. I need to go back to that.
Yeah. And I want everyone to hear, Christy got a PR like 7 months after on her overhead. Obviously, she was working at that. And I've gotten several PRs since. And I think a big part of that is because, again, for the first time in my life, like I was isolating my chest because I wasn't fearful of losing more. So I strengthened the whole area. So that was huge. One other question that I sometimes get that I think is important is people are, especially with our sport where we have weight cuts. I always had to make 180 pounds for the middleweight woman. People are like, did it make you heavier? And I couldn't believe it because, again, there's like 600 cc's in there, but it didn't affect my weight at all.
Yeah,
So
they don't weigh that much. So mine, I didn't tell everyone my CCs. I think mine are four, I think they're 450
are yours, do you remember if
CCs.
yours are the same on both sides? Because I purposely have more
Yeah.
cc's in one because
No,
most people
mine's,
aren't
yeah.
symmetrical.
Yeah, no, I think mine are the same. But he said mine weigh a pound each, so it brings me up 2 pounds apparently.
Oh, okay.
So yours are probably a little more than a pound each. But I mean,
Yeah.
like, it is what it is. It's just, it's not gonna be anything more than 3 pounds. Like most people are gonna be like, you know,
Yeah. And the
2-ish
scale
pounds.
fluctuates so much that you definitely wouldn't be able to properly track that because after surgery, you went under, so you're going to be
Yeah.
bloated and
Oh
then you're
yeah,
not
I
training
weighed. I
for a
weighed like
while.
five. I did weigh myself. I actually tracked my weight because I'm a nerd. Before surgery, after surgery, the days after surgery, and everything. And I did go up like 5 pounds the day after surgery. I was 5 pounds, and then slowly went back down. Um, so I mean, for us, like 2 pounds doesn't really make so much of a difference. Like we can gain or lose that very easily. So I wouldn't be so concerned. But yeah, people are always like, how much does weigh or something like that. Like they're like these huge things. They don't really weigh that much.
Yeah. I feel like we covered a lot of the specifics about athletes. I just kind of want to overall talk about, ways, besides obviously if you're listening to this, it's of interest to you. I think the best advice I could give would be talk to people about their experience, go to several different doctors and, make sure you're in a good place. Like, cause I had someone with me after surgery. I know people that have gotten it with no help. I wouldn't recommend that just because you never know what can go wrong. And you obviously don't want to be like driving and stuff the first few days. But other than that, you'll notice kind of like any community, it almost feels like once you get them, like you'll joke with other women like, oh, you have them too. And I think that's what I was most surprised about was I kind of thought it was like this taboo thing. And I'm like, wow, I feel like everyone has breast implants. Like people like once you start talking about it, people that you wouldn't ever expect, like old teachers reached out to me. I was like, oh my God, my fourth grade teacher had breast augmentation. Can't believe it. Or like my mail
Oh my
lady.
God.
Yeah.
That's
So it's more common
hilarious.
than you think. Definitely not as taboo. Like I said, I believe it's one of the most common surgeries. It's almost like having braces to some degree. I don't know if that's a good analogy, but
It might be a good analogy, but yeah, I mean, yeah, don't be afraid to, reach out to other women who have really that's I mean, you want to be really sure that you are getting the right type for you, and it is a big deal. There really is a surgery. Of course you can take them out, but once you have a surgery, there's no going back. You can't reverse scars, you can't reverse, you know, you can't like get your money back. So be really, really sure that you want to, and make sure you're in a good place mentally for it, and are thinking long term as well. Because for me, with my decision, I was thinking, okay, I do lift now, but I do want them to look a certain way when I'm, 10 years down the road, when I'm not lifting as heavy and stuff. And that's kind of why I went the route that I went. So try to take into account, not just right now, but like, let's say, you know, in a few years, if you want to have kids or something, take that into account, um, of your lifestyle.
and most importantly, do it for you. And like anything, know that you're going to get some pushback. The breast implant illness crew might have something to say. And then other people, I think that was the most shocking to me, Christy, was people like family members, most people were supportive, but there were a couple people that said like, why would you do that to your beautiful athletic body and things like that. So just be prepared. There's always going to be some naysayers when you make a decision for anything. And I'm sure when we release this episode, I'm probably going to put like a before and after picture of what I look like. And I'm sure there'll be people saying like, you looked
I
better
look
before. Why would
beautiful
you?
before, yeah, and
Yeah,
any before and after picture will get that, which is it's super annoying. 'Cause it's not really like the point, but honestly, no one's ever all going to be happy. So what's the most important is that you're happy, because I mean, no matter what you do, everyone can just call you fat on the internet. You lose 30 pounds. Everyone say you look disgusting, unhealthy. Oh my God, what happened? You look better before. Then you get, like there's so many, like, no one's ever happy. So don't even care. It really doesn't
yeah.
matter.
But yeah, overall, I just want to leave with I am so happy with my decision. Again, I pondered it for over a decade before I took the plunge, and I have absolutely no regrets. And I love them, super happy with them. And yeah, I wouldn't change a thing.
Yeah, I'm super happy with mine too. I definitely think I want to go bigger at some point, whether that's sooner or later. But I had a really good experience, and so I hope if you're getting them or thinking about getting them, that you have the same easy experience as us.
Absolutely. And for girls listening that want to get it, don't be afraid. You can reach out to us after if you want some help navigating the weight room, or if you have any specific questions, you can reach out to Chrissy or I. And last but not least, we want to talk about stuff that is meaningful for you guys and is truly going to help you make a decision and be, open and candid about it. So we have an anonymous link that you can submit your questions. So feel free to ask us pretty much anything. Anything else you want to say, Christy?
No, just ask us anything. Give us ideas for topics for the podcast. This is really fun. Or if any guests you want us to have on, all that fun stuff. Because I think we really like topics like this, that we can kind of share our own experiences. This kind of everything that we like to do. We just want to help people and be helpful.
Absolutely. And please share this episode with someone that may be considering getting surgery. Thank you.
Yep. Bye.
Bye.